This is the part 2 of our discussion about protein. We will be looking at animal protein. As I said in the earlier video, the animal protein have the advantage of having all the amino acids, and it has some uh, minerals and vitamins. So animal proteins are divided into red meat and white meat. You must have noticed that most of the doctors that specialize in diabetes advise diabetes patients against using red meat. The reason being, red meat has more cholesterol, more saturated fat than white meat. And saturated fat usually elevate your cholesterol and put you at risk of heart attack, stroke, and problems with your leg. If diabetes patient is not having adequate blood supply to his leg, there's risk that if he develops any wound on his leg, it may be amputated. So also, red meat increase the risk of cancers. Diabetic patients that take a lot of red meat, they are at risk of prostate cancer, colonic cancer, and other type of cancers. So you can see that red meat is not suitable for a patient living with diabetes. Red meat also increases the level of uric acid. That's why you observe people that take a lot of red meat complain of joint pain all over. It's because of the accumulation of uric acid in their joints. However, white meat has less cholesterol. It has less saturated fat. The kind of fat that white meat has is unsaturated fat, which protects the heart. Examples of white meat are fish, chicken, turkey, guinea fowl, duck. On the contrary, examples of red meat are meat gotten from cow, goat, sheep, most animals that walk on 4 feet. They are usually sources of red meat. So that's the reason why I prefer white meat to red meat. But I know a lot of you love red meat and you cannot see yourself stopping red meat at all. I have an option for you. If you look at this video, there are certain parts of the beef that you can get lean meat. The meaning of lean meat is that part of the beef that has minimal or no fat. So if you look at it critically, there's tenderloin, there's round meat, and the rest that you can see there. So these aspects, if you have a professional butcher that can get these parts for you that has minimal or no fat, you can go ahead and take small of it. But if you do not have that, my caution is avoid red meat. You can use white meat. But even the white meat, you have to take it with caution. You take about the size of your fish. So if you are taking fish, that will be like 2 or 3 cut. All right. So because whatever you do, if you take excess of it, at the long run, you may not get the advantage, but the disadvantage. So I hope you understand that diabetes patient can take meat, but preferably white meat. But if you insist on taking red meat, you must take lean meat, the aspect of the meat that has minimal or no fat.